Hi friends, welcome to Nursing Jillfish. In our channel, we are looking for all type of nursing competitive exam preparations like example NCLEX, prrometric, haad, DHS and esic, JIPMER, RRB, aims, all CHO examinations, state and central government, along with even for nurse genius app, you are having all the facilities of exam questions paper also. And if you have any doubt under registration renewal BLS, you can kindly contact us. Before preparation, you have to read the questions thoroughly and go for answer. Children with special needs have the same needs as those without special needs, although their means of satisfying these needs may be limited. So, what effect should the nurse expect that these limitations will frequently cause in the child? It is. So, the option A, frustration, option B, overcompensation, option C, feeling of rejection, option D, emotional dysfunction. Actually, the child is having the special needs, but it is not able to attain. So, what is going to be happen? That frustration. Yeah. So, the option A will be the correct answer. So, next question. A nurse assesses a client recently admitted to an alcohol detoxification unit. What common clinical manifestation should the nurse expect during the initial stage of alcohol detoxifications? Option A, nausea. Option B, euphoria. Option C, bradycardia. Option D, hypotension. So, what is the correct answer? Can you guess it? That yeah, the person is having alcohol detoxification. So whenever you are getting the toxifications, so what is going to happen? That it is nausea and vomiting. Here only nausea is available. So what is the correct answer? Nausea. Option A will be the correct answer. Next question. After an abdominal hole cystectomy, a client has a T-tube attached to a collection device. On the day of surgery at 10:30 p.m., 300 ml of bile is emptied from the collection bag. At 6:30 p.m. and the next day, the bag contains 60 ml of bile. What should the nurse consider in response to this information? Option A, the tube may have to be irrigated. Option B, the bile is now draining into the duodenum. Option C, mechanical problem may have developed with the tube. Option D, suction must be re-established in the portable drainage system. Actually, what is the question here? The person is having abdominal hole cystectomy. So what is happening there? First day the 10:30 p.m. 300 ml of file, and the next day only the 60 ml of file. So what about the bile, remaining bile? That means the black of the tube. Something is going to be pink or black, something in obstruction on the tube it is. So what could be the correct answer? Option C, mechanical problems may have developed with the tube it is. So that is why you have to be monitor the patient whenever the patient is on whole cystectomy it is. And also you have to maintain the IO chart. It is very essential. Next question. A nurse in the emergency department is assessing a client who was beaten and sexually assaulted. Which is the nurse's priority assessment? Option A, family feelings about the attack. Option B, the client feelings of social isolation. Option C, disturbance in the client's thought process. Option D, the client's ability to cope with the situation. So what is the correct answer? Actually, the patient was sexually assaulted and also beaten. So what you have to do the priority? Yeah, you have to tell the patient to cope up with the situations. So that means answer D. Option D is a correct answer. We have to cope up with the patient's it is. So that inability coping mechanism, that is a nursing diagnosis. Okay, next question. A healthcare provider orders oxygen therapy via nasal cannula at 2 liters per minute for an older confused client with the heart failure. Which nursing action is the priority? So option A, maintaining the client on bed rest. Option B, determining whether the client is agitated. Option C, obtaining a cannula of appropriate size for the client. Option D, investigating whether the client has chronic obstructive pulmonary disease. It is. Actually, what is the question? The patient is on nasal cannula 2 liter per minute. Confused client with heart failure. If the person is having confusion, automatically they will be forgot everything. They doesn't know what is that is going on. So maybe he is getting angry. So angry is it is one of the agitations. So what is the correct answer? Option B, determining whether the client is agitated. So that will be the correct answer for this question. It is. Okay, fine. Next question. A healthcare provider ordered oropharyngeal suctioning as needed for a client in coma. Which assessment made by the nurse indicates the need for suctioning? So the patient is on coma and need a suction. Option A, gurgling sound with each breath. Option B, fine crackle at the base of the lungs. Option C, cyanosis in the nail bed of the fingers. Option D, dry cough at increasingly frequent interval. It is. Actually, what is the condition of the patient? The client is in coma and oropharyngeal suction is needed. Which conditions? Cyanosis, no need. Dry cough, no need. Fine crackles at the base, that is a normal. And which one is the correct answer? Yeah, answer option A, gurgling sound with each breath. So that should be the sign of increased secretions. You have to go for the suctioning. Oropharyngeal suction is needed for the patient. So option A will be the correct answer. A parent of 3 young children has contracted tuberculosis. Which should the nurse expect the healthcare provider to prescribe for members of the family who have a positive reaction to the tuberculosis skin test and or candidate for treatment? It is. Option A, isodicide. Option B, multiple puncture test. Option C, basilic calmate gyrine. Option D, purify protein derivative. So what could be the nurse should do for this type of cases? The correct answer is isoniazid, because the patient is having the tuberculosis and the getting treatment also. So you have to provide isoniazid to the children also. Next question. A client is diagnosed with varicose vein and the nurse teaches the client about the pathophysiology associated with this disorder. The client asks, what can I do to help myself? What should nurse respond? It is. Option A, limit walking to as little as possible. Option B, reduce fluid intake to 1 liter to a liquid a day. So option C, apply moisturizing lotion on your legs several times a day. Option D, put on compression course before getting out of bed in the morning. It is. Actually, the patient is having, what is the problem? It is varicose vein. So what you have to do for that? It is, you have to apply compression stockings. So what could be the correct answer? Yeah, option D, put on compression course before getting out of bed in the morning. So that could be the correct answer. A nurse is caring for a newly admitted client with anorexia nervosa. What is the priority treatment for the client at this time? Option A, medication to reduce anxiety. Option B, family psychotherapy section. Option C, separation from family members. Option D, correction of electrolyte imbalance. What should do for the patient? The patient is having anorexia nervosa. So usually what will happen, that the patient going for fasting like that, they will not eat anything. So automatically they will get tiredness. It is. So what you have to administer? Yeah, you have to maintain the electrolyte imbalance. So what could be the correct answer? Option D will be the correct answer. Next question. A client with acquired immunodeficiency syndrome is receiving treatment protocol that includes a protease inhibitors. When assessing the client response to this drug, which common side effect should be nurse expectators? Option A, diarrhea. Option B, hypoglycemia. Option C, paresthesia of the extremities. Option D, seeing yellow halos around lightitis. Actually, the patient is having AIDS. So, what could be the common side effect it is? Yeah, usually the patient is getting what is that? Diarrhea will be the common side effect it is. So, option A will be the correct answer. Next question. A nurse teaches a client about warfarin. Which juice to avoid identified by the clients indicate that teaching is very effective it is. Option A, apple juice. Option B, grape juice. Option C, orange juice. Option D, cranberry juice it is. Actually, the person is taking what type of the drug it is? Warfarin. So warfarin is an anticoagulant it is. So if you are taking warfarin, which juice should be avoided? Can you guess it that? Yeah, option D, cranberry juice. Why should not take? Because cranberry juice also going to make a blood thinner. So that is why you should avoid taking with the warfarin drug it is. So option D will be the correct answer. Medication is prescribed for a 7-year-old child with attention deficit hyperactivity disorder. What information should the school nurse emphasize when discussing the child's treatment with the parents? So, option A, tutor the child in the subject that are troublesome. Option B, monitor the effects of the drug on their child's behavior. Option C, explain to their child that the behavior can be controlled if desired. Option D, avoid imposing too many rules because this will frustrate the child it is. So what you have to do the advice for the attention deficit hyperactivity disorder. If they are taking drugs, so what you have to do for it? Yeah, as a nurse, monitor the effects of the drug on their child's behavior. That is option B will be the correct answer. If you want more examinations and also free exam and mock test, it is available in the Nurse Genius app for the all prrometric, haad, NCLEX, all the examinations, central and state government exams also. You can practice in the Nurse Genius app it is. Okay, fine. Next question. A nurse perform preoperative teaching for a client who is to have cataract surgery, which is the most important for the nurse to include concerning what the client should do after surgery it is. Option A, remain flat for 3 hours. Option B, eat a soft diet for 2 days. Option C, breathe and cough deeply. Option D, avoid bending from the waist it is. What could be the correct answer for this? Yeah, the correct answer is avoid bending from the waist it is, because the patient is going for what type of surgery? Cataract surgery. So you have to give the advice that later too you should not bend, it is below the waist it is. You have to give the pre-operative teaching it is. Next question is, a nurse is supervising a recently hired nursing assistant who is caring for a debilitated bedbound client. What intervention being implemented necessitates that nurse intervene? So option A, draining the client urinary collection bag into a measuring container. Option B, taking the client's blood pressure with an electronic sphygmomanometer. Option C, removing boots that kept the client feet in dorsiflexion before giving a bath. Option D, replacing a dressing on the client's buttocks that was contaminated with fecal material. So actually what is the question here? Recently hired nursing assistant who is kind for deflated bedbound client it is. What it mean by bedbound client? That is bed sore, bed ulcer it is. So what could be the correct answer? Can you guess it that? Yeah. What is that? Urinary collection, blood pressure, it's both, it's nothing else. Only option D, replacing a dressing on the client's buttocks that was contaminated with fecal material. That only the correct answer for this question it is. Okay, fine. Next question. A client is receiving apotin for a treatment of anemia associated with chronic renal failure, which client statement indicates to the nurse that further teaching about this medication is necessary. So the patient is on anemia. Okay, fine. And also is having the renal failure. Option A, I realize it is important to take this medication because it will cure my anemia. Option B, I know many ways to protect myself from injury because I am at risk for seizure. Option C, I recognize that I may still need blood transfusion if my blood values are very low. Option D, I understand that I will still have to take supplemental iron therapy with this medications. Actually, what should be the correct answer? Can you guess it that? Yeah, the client is having the what is that chronic renal failure and also anemia and taking for the episode. So what would be the correct answer? Yeah, option A. I realize that it is very important to take these medications because it will cure my anemia. So option A will be the correct answer. Which of the following is the appropriate position for a patient who is suffering from acute asthma attack? It is. So, what is the position you have to give for the asthma attack patient? Option A, right lateral. Option B, supine. Option C, high Fowler position. Option D, prone position. What could be the correct answer? Can you guess it that? Yeah. High Fowler position you have to provide for the patient with acute asthmatitis. So usually we are, if the breathing difficulty is coming, we are going to provide Fowler's position. So that could be the correct answer. A patient with COPD is admitted to the hospital. How can the nurse best position the patient to improve the gas exchange? It is. So option A, sitting up the bedside in a chair and leaning slightly forwarded. And option B, resting in bed with the head elevated 45 to 60 degree. Option C, in the Trundle position with several pillows behind the gate. Option D, resting in the bed in a high Fowler position with the knee flexitis. So the patient having COPD. So what you have to provide? We have to provide the sitting up with the bedside in a chair and leaning slightly forwarded, so that position will be comfortable for the COPD client test. Okay, fine. So answer A will be the correct answer. Following a tympanoplasty, the nurse should maintain the client in which position? Option A, Paulus with the operative ear facing down. Option B, low Trendelenburg with the head in neutral position. Option C, flat with the head turned to the side with the operative ear facing up. Option D, supine with the small neck roll to allow for drainage it is. So what could be the correct answer? Can you guess it that? Yeah, the person is going for which surgery it is? Yeah, tympanoplasty. That is a ear surgery it is. So what is the position we have to be administered? Yeah, option C, flat with the head turned to the side with the operative ear facing up should be done. So that means option C will be the correct answer. Next question. It is a very easiest question. Which of the following is the proper position for a patient undergoing a cardiac surgery? Option A, supine. Option B, prone. Option C, lateral. Option D, Paulus position. Additionally, what is the surgery it is going to be happen? Cardiac surgery. Cardiac surgery related to heart it is. So which position you have to maintain? You know that everyone. What is that? Supine position. The correct answer is option A it is. A nurse is caring for a toddler after surgical repair of a cleft palate. The nurse should position the child. Option A, on his back. Option B, on his stomach. Option C, on his back with his cut slightly elevated. Option D, for comfort it is. Actually, for the toddler, what is the name of the surgery? That is cleft palate. So what is the position for the child it is? Yeah, Answer B. Angus stomachitis. I think you have understand all the question answer. If you like this video, kindly like and comment this video and also subscribe my channel. If you have any doubt, you can clarify it. Thank you for watching a Jellyfish.